Portugal has free universal health care. It's had it for almost 50 years. So here's what confuses a lot of Americans who move to Portugal. More than a third of this country pays for private insurance on top of their free health care coverage. And that private market isn't shrinking, it's growing. If you followed the healthcare fight in America, that isn't supposed to be possible. So in this video, I want to show you how Portugal ended up with two healthcare systems, the public and the private system, running side by side. Why that happened, how it works, what it costs, and whether this model could work for the United States. If you like this kind of stuff, please hit the like and subscribe buttons, and let's get into it. Let's start with how Portugal got here, because the history explains the hybrid. For roughly 4 decades, Portugal was a dictatorship under Antonio de Oliveira Salazar. During his ruthless regime, healthcare was fragmented. It was mostly run by churches and religious charities, propped up by a limited social security scheme that covered less than half the country, with almost nothing reaching rural areas.
Everything changed on April 25th, 1974. The dictatorship was outed after nearly 50 years. It was a bloodless coup that became known as the Carnation Revolution.
2 years after that, Portugal adopted a new constitution that guarantees health care as a fundamental right for every citizen. And a few years after that, the country introduced the SNS, the Serviço Nacional de Saúde, a single, tax-funded national health service created specifically to guarantee care regardless of someone's income or job. Here's how it actually works. It's funded through general taxation, not a separate payroll deduction or a premium the way Medicare is funded in America. It covers every legal resident, which includes immigrants like me with a residence permit, not just Portuguese citizens. You register at your local health center, you get assigned a family doctor, and from there you have access to regular visits, hospital care, emergency care, maternity care, and subsidized prescriptions. At the point of use, most of that is free or close to it. There's one notable exception, and it catches a lot of new arrivals off guard. Dental care has never been part of the public system. Most people need private insurance for that or pay out of their pocket. And something else that surprises people, this is not a paperwork-heavy, rubber stamp bureaucracy. You see it most clearly at the pharmacy. Prescriptions here are fully digital. Your doctor sends it straight to your phone. It connects to a national system. You walk into essentially any pharmacy in the country, they scan it, and you're done. It's the same with everything else. My test results, my vaccination record, the medications I'm on, I can pull all of that up on the SNS app whenever I want, although private care doesn't automatically show up there. Meanwhile, in America, roughly 7 in 10 American hospitals were still using mail or fax machines to exchange patient records. That's according to a 2019 survey. And there's been some improvements since, but inside the public system here, nobody's mailing or faxing anything. Now, I'm not going to sit here and tell you the healthcare system in Portugal is perfect. It isn't. There are real problems. And the private insurance market exists mostly because of them. The biggest one is wait times. At the end of December, according to the health regulator, the ERS, just over 1 million people were waiting for a first hospital consultation. That's up 17% in a year. And about 44% of them had already been waiting longer than the law allows. Surgery follows a similar pattern. Cardiac surgery is the worst of it. The number of people waiting for heart surgery jumped about 40% over the course of a single year, and nearly 60% of them were waiting longer than is clinically recommended. There's another measure worth knowing about, especially for elderly patients. When someone over 65 breaks a hip, the clinical standard is surgery within 48 hours. In 2023, more than half of people 65 and over with a hip fracture in Portugal waited longer than 48 hours for surgery, the third worst result in the EU. So what's causing all this? The obvious answer is that Portugal doesn't have enough doctors, but it's actually more complicated than that. On paper, Portugal has plenty of doctors, more licensed doctors per person than most wealthy countries, almost 6 per 1,000 people. But that's a bit misleading because it includes every doctor who has ever been licensed here, including people who've retired or moved abroad to practice someplace that pays better. Where the shortage actually shows up is in the distribution. Not enough doctors are choosing to work inside the public system instead of private practice, and they're heavily concentrated in the cities at the expense of the interior. Rural residents travel further for specialist care, wait longer, and are more likely to have no family doctor assigned to them at all. There's a nursing shortage, too, about 7.6 practicing nurses per 1,000 people, when the average for most developed countries is 9.2. And this is exactly why private insurance grew the way it did. Private insurance in Portugal is not a recent reaction to a failing public system, and it was never meant to replace it. It's been part of the picture since the SNS was created. What's changed is how mainstream it's become. Right now, about 35% of the population has what researchers call dual coverage, simultaneous access to the SNS and a private insurance plan. That's roughly 1 in 3 people, and it's growing. Just over a decade ago, dual coverage ran around 20%. And here's a number that puts it in context. The European average for dual coverage is about 10%. Portugal is running at more than 3 times the European rate. Widen that lens to include employer-based plans, and you get to 58% of the country holding some type of coverage beyond the basic public system, about 25 percentage points above the European average. Now, why do people buy private insurance? Almost nobody I've talked to buys it because they think the private doctors are better. Most people here are quite satisfied with the care they get in the public system once they actually get seen. The issue is speed. If you want to skip a months-long wait for a specialist or an elective procedure, private insurance gets you there faster, while the public system stays underneath you as the safety net. And you'll hear that a lot from expats. They rely on the public system for emergencies and the private system for routine and specialist care. It's not a hard rule. The SNS handles plenty of serious, complicated cases extremely well. And it isn't limited to emergencies. But as a general approach, using the SNS as your backstop while leaning on private care for checkups, dermatology, physical therapy, minor procedures, that's how most long-term residents end up splitting things once they've lived here for a few years. Either way, nobody in Portugal goes bankrupt from a hospital bill. Nobody gets turned away from an emergency room, insured or not. That alone is a significant health factor. Living with the constant threat of a crushing, unexpected medical bill in America causes years of low-grade stress that never shows up on any treatment statistic. So what does the private option actually cost? A basic private plan for a younger adult runs 20 to 50 euros a month, while a comprehensive plan for an older adult can run 100 to 300 euros or more. My wife and I have a comprehensive plan with MGEN, one of the major insurance firms here. For the two of us, it costs about 485 euros a month, and that's on top of the public system we're both already entitled to. Compare that to prices in the US. Most Americans get their coverage through their jobs, so the full cost is invisible to them. Their employer pays most of it. But I know a lot of people watching my channel are self-employed, digital nomads, or people who've retired early. That means they get their coverage on the individual marketplace. Right now, the national average for a benchmark plan, that's the second lowest cost silver plan, runs about $625 a month for a 40-year-old before any subsidy. And that's just about what I was paying when I was self-employed back in the States. For a couple, a policy runs about $2,500 a month. That's more than 5 times what my wife and I pay for a similar coverage. So the private option Portuguese people use to skip the wait time in the public system isn't a luxury item. For a lot of people, it costs less per month than their cable bill. The cost of prescription drugs is where you'll really notice the difference. And I'll give you a personal example. I had minor surgery recently and was prescribed a blood thinner called edoxaban. In Portugal, it cost me 20 euros out of pocket. In the US, that same drug runs close to $500, even with a manufacturer discount coupon, or if your insurance plan has a high deductible. That's not a freak outlier. A RAND Corporation study comparing the US against 33 other wealthy countries found that American prices for brand name drugs average more than 4 times what the same drugs cost abroad. Generics are a different story. The US is often cheaper on generics, running about 2/3 of what other countries pay. So if you're on an older medication with a generic available, you might not see much savings in Portugal. But if you're on a newer drug that's still brand name only, the difference can be enormous. By the way, pharmacies here are a completely different experience from a CVS or a Walgreens. You don't go there for Pringles and lawn chairs. They function more like small clinics, and the pharmacists do a lot more than count pills. That's its own story. I've got a separate video on Portuguese pharmacies coming, and I'll link it once it's up. So with all that context, let's look at what each country gets for its money, the health outcomes. This is where it gets interesting. Life expectancy in Portugal is 82.5 years. In the US, it's 78.4. That's a 4-year gap. Self-reported obesity in Portugal is 16%. In the US, it's more than double, 35%. There's a measure researchers use called treatable mortality. It counts people who died before the age of 75 from something medicine already knows how to handle, like a cancer that screening could have caught, diabetes that should have been managed, pneumonia that could have been treated. Portugal loses 63 people per 100,000 that way. 63 people who should have lived longer if they had gotten adequate care. In the US, that figure is 95, about 50% more. And Portugal produces these better numbers while spending far less per person on healthcare than in the US, about $5,212 a year versus almost $15,000 in the US, nearly 3 times more. Now, to be fair, and this matters, not all that gap is about the healthcare system. There's a second measure called preventable mortality, deaths that could have been prevented by lifestyle changes or other factors, nothing to do with whether or not you see a doctor. Things like your diet and exercise, car dependency versus walkable cities, gun violence, which is extremely rare in Portugal, or the opioid crisis, which has no real Portuguese equivalent. In Portugal, preventable mortality is at 117 per 100,000. The US is at 217, nearly double. But again, many factors that drag those American outcomes down are different or non-existent in Portugal. So it's not a clean apples to apples comparison, but it does undercut the idea that spending more money automatically buys you better health. Portugal gets far better outcomes on a third of what the US spends. And universal coverage that removes a cost barrier to walking into a doctor's office is clearly part of that. When a visit isn't going to cost you $150 out of pocket, you go there when something's wrong instead of waiting to see if it gets worse, or only when you can afford it. That's one more reason people in Portugal are healthier and live longer. So, could a system like this actually work in the United States? That brings us back to the social media post I mentioned at the top. A woman wrote, "I have a question for those people who want Medicare for all. What happens to all the health insurance companies? What happens to all the people employed by them?" That's one of the most common arguments against universal coverage in America, and Portugal is direct evidence against it. The private insurance market here isn't merely surviving next to a universal system. It's a multi-billion euro industry that is actively growing, and it now covers roughly a third of the population on top of guaranteed public coverage. Universal coverage didn't kill the private insurance market. Universal coverage is the floor it's built on. And here's the part that surprises people. The US is already doing this. More than half of the 64 million people on Medicare, the government's health care coverage for seniors over 65, is enrolled in Medicare Advantage, where private insurance companies administer government-guaranteed coverage and compete for that business. That's a universal government program for seniors and disabled Americans with private insurance thriving inside it, not despite it, because of it. So this either-or objection, public or private, pick one, isn't really a prediction about the future. It's already been disproven inside the US healthcare system itself, just for one part of the population instead of all of it. Now, I realize scaling anything to a country of 340 million people with a completely different insurance and political landscape is a far bigger undertaking than what Portugal did for 11 million people. The transition costs are real, the employer-based systems are deeply entrenched. Reasonable people disagree on all these details, and I'm not pretending those obstacles are small. They're not. But the specific claim that universal coverage and a private industry can't coexist simply isn't supported by the evidence, not here in Portugal and not in America's own Medicare system. But come on, America is the wealthiest nation on earth. More than 80 countries worldwide provide some form of universal health care for its citizens, including relatively poor countries like Portugal. It shouldn't be that hard to figure out how the US can join the rest of the developed world and do the same thing. If this video gave you a better handle on how healthcare works here, and a better way to think about the argument back home, do me a favor and hit that like and subscribe button. And feel free to leave a comment below. And if you want to see more about healthy living and daily life in Portugal, check out these videos right here. Until next time, até logo.